Okay. So good evening, everyone. A warm and a humble, I'm so sorry, a warm and a humble welcome to the 74th webinar of the webinar series under youth and adolescent. My name is Shivani Bhatia.
And I'm Meghal. Both of us will be moderating today's webinar.
A brief introduction about SHARP NGO. SHARP stands for School Health Annual Report Program. It's a pan-India non-governmental health organization working from over 22 years in the field of holistic development and healthcare of students and children.
The pandemic has accentuated many mental health problems in people of all age groups. And to improve the access to quality mental health care services, a national Telemental Health program will be launched soon. This eventually will be helpful for those battling any sort of mental health disorders by getting appropriate medical attention in less time and money. But this can prove to have a long journey in terms of destigmatization and awareness about the same.
Meghal, can you please switch on your camera as well?
I'm sorry.
It's okay. Okay. And to continue further, we still have many questions in our mind related to Telemental Health program. Like, can this telecall program become the easiest channel of access for people and mark the revolutionary change inside out? Can one be sitting in any part of the country to access these services without spending time on traveling or waiting? Can this initiative will allow our country to normalize the seeking mental health guidance and many more?
And for the same objective of discussion, we have with us our esteemed panelist, Ms. Tanya Kukade, Dr. Arun P. Jose, Mr. Darren, and Ms. Anandita. We welcome you all, and we are really privileged to have you all with us.
Few instructions before we start our webinar. We will first have a round of discussion with all our panelists, and then we are going to have a Q&A round. Audience, you can drop in your question in the Q&A box because we will be taking up live question. And two best sharpest question of the day will get a gift voucher worth ₹500. And audience, we request not to fill the chat box with unnecessary messages because we may tend to miss out the important question.
So now, without any further delay, I would like to invite our panelist, Ms. Tanya. Tanya is a member of the Pharmaceutical, Healthcare and Medical Device team at Nishit Desai Associates. She contributes in advising clients in pharmaceutical, medtech, and life sciences industry on regulatory, commercial, litigation, and intellectual property matters. In addition to this, she is involved in writing in various topics on pharmaceutical, technology, and intellectual property laws. We welcome you, ma'am.
Next on our panel, we have Dr. Arun Jose. Dr. Jose is a Deputy Director of the Center for Digital Health at Public Health Foundation of India. He's a physician and a public health specialist by training and currently lead various digital health and capacity building program in India. Dr. Jose was also awarded the NIH-funded Global Health Leader Fellowship in Leadership and Implementation Sciences. He's also a fellow of the International Society for Cardiovascular Diseases and Prevention and fellow of the World Heart Federation Emerging Leaders and Program. Honor to have you on floor, sir.
Next, we have Mr. Darren. He's a leader in the pharmaceutical and life sciences team and leads the medical device and digital health practice at Nishit Desai Associates. He's mainly involved in advising many multinational and domestic clients in industries like pharmaceutical, medtech, and life sciences. In addition to this, he has been a part of many pharmaceutical and healthcare transactions to provide investors with inputs that are unique to this industry. He regularly contributes to many national and international publications, writing on various topics related to pharmaceutical and healthcare regulations. We welcome you, sir.
Last but obviously not the least, we have Ms. Anandita. Ms. Anandita is a psychologist with a vast experience in the field of mental health and gender and a passion for community work through a social justice lens. Currently, she's working as a psychology educator with a school and an independent therapist using different approaches in her practices. So great to have you on floor, Ms. Anandita, and all the panelists. Thank you so much for joining in today. So now we can have some questions. Like we can go ahead with our question. So my very first question, which is very basic, is to understand what basically telemental health services are going to be and how it going to work. Because we have many students and parents in our audience. So if we can tell them what basically these services are going to be and how it's going to work. So any of the panelists would like to take up this question? Dr. Josh or anyone?
Thank you, Shivani, and thank you for this invitation to be a part of this panel, and a very good afternoon to all the panel members as well as the audience. So with regards to the Telemental Health Program, and especially the National Telemental Health Program, we're yet to see what exactly the roadmap is of the government, although there have been a little details that have been put out. That is that it's going to be led by the National Institute of Mental Health Sciences at Bangalore. And there will be 23 folks or other partner institutions along with IIT Bangalore as the technology partner. But apart from this, in general, if we look at telemedicine and telehealth, so these terms have very small nuances between them. The differences in the meaning is very, very subtle. But the scope of telemedicine is actually a lot larger than what we think it is. Initially, we would think of telemedicine as the normal telemedicine we think about is the prescription that we use for curative services for diagnosis of screening, detection, and for treatment of illnesses. But apart from those, it is also used as a good channel for health education, for skill building, for capacity building, and it can be a very useful resource, a very useful public health resource for improving task shifting and task sharing between different members of the healthcare community. So, so to put my answer in brief, I think the scope of telemedicine goes beyond just curative services. There are a lot more. The scope of telemedicine is a lot more than just providing treatment over an online service, but it also reaches out to students, teachers, as well as parents for education, for building awareness, for building skills and capacity building of various health professionals in providing mental health care. I think I'll stop with that.
Any other panelists would like to add on this?
Sure. Maybe I'll go next. And thanks, Dr. Jose. I think that was succinctly put. But I think, one thing that I admire with this announcement of the program is that the government's continuing support for telehealth overall, which is very important, because if you look at the pre-pandemic and post-pandemic era, you see a major shift in the way in which the government has approached the treatment of digital health as a healthcare service altogether. And as lawyers, we can tell you, it was a very difficult situation pre-pandemic, because one recognition for digital health as a service itself was very difficult, primarily because you have your territorial limitations for where doctors can practice. Are you even allowed to prescribe over an audiovisual platform? Are you able, and what kind of a prescription is valid, etc.? All of these questions kept popping up, and although you still had a lot of players who had identified the gap in the overall healthcare system, and they believed that the way in which we could fill that would be through digital health, especially because today we rely so heavily on the private healthcare system, because we don't particularly have a very robust universal healthcare program, and outside of the tier 1, tier 2 cities, we're seeing difficulty in penetration of healthcare, especially in the rural areas. So that gap that we were trying to fill, a lot of players in the digital health space tried to pick it up and try and fill that entire situation. What we did see in 2020 with the start of the pandemic is basically a culmination of a lot of efforts that were put in by the industry prior to that, which is basically the push to legitimize and recognize digital health as a legitimate healthcare service. And because of the pandemic, I would say that what could have taken another 5 to 6 years has really been pushed back, and we've automatically seen a lot of things come into the forefront, especially because of the fact that remote healthcare became very important during the lockdown period, right? And I think because of this whole, I would call it a success in terms of what we've seen from 2020 onwards in terms of how well things have been adopted, both from the physician end, because there was a lot of hesitation pre-pandemic for physicians and counselors to get on board with the entire system. So we see a lot of adoption now on the physician end, but at the same time, even on the patient end, we're seeing a lot more compliance and a lot more adoption. So basically, there's a lot of comfort today with being able to use digital platforms as a media for receiving healthcare services, right? And I think the logical next step was to go beyond the traditional healthcare ecosystem to health and wellness as well as mental health. And I think that's actually a very good sign, because it basically it solidifies all the efforts that have been undertaken over the past couple of years, and now we've moved that and we've taken the next step to try and increase the penetration for healthcare in India. I think two things, right? One is with the initiation of the whole pandemic situation, we also saw a national telemedicine program itself, whereby you had the government participate very fruitfully in this entire situation, where they set up their own telemedicine programs through various institutes. And I think because of the success of that is now why we're seeing, I mean, two reasons, of course, because the pandemic has been going on for so long, obviously mental health has become something that is the buzzword for most countries worldwide. And I think it's a very good step that India has both recognized and done something to facilitate the improvement of the overall mental health in the country. Because I think somebody has also mentioned there is still a lot of stigma involved in this whole mental health services and the provision of mental health. And I think the fact that you're openly, and especially in the budget, which is one of the most viewed programs in the country, to actually talk about mental health as a challenge and as something that needs to be addressed, I think was a very good move from the government side.
Thank you, sir. I would like to ask something to Ms. Anandita now. Ma'am, especially when it comes to counseling, and it is very important, a physical aura and the physical presence to make the patient or client feel very comfortable. So don't you think this digitalization of all of this makes it a little difficult to form a rapport with the patients so that they disclose everything and their needs are met?
Yeah, so a shift from offline to online therapy, it has definitely brought up a lot of challenges in itself. And I'm really sorry, there's a lot of background noise. There is some election rally going on. I'm in Uttarakhand. But yeah, so there are a lot of challenges that come in with online therapy. There are a lot of extra set of guidelines that have now come up to be more careful in terms of online therapy, and also recognizing the different limitations that exist for online therapy. Because with offline therapy, as you mentioned, the in-person presence, that aura, that brings in a lot of support, that brings in a lot of comfort for both the therapist as well as the client. And in an online setup, that rapport building takes a lot more time, it takes a lot more sessions, and like bringing in that comfort. Maybe it happened in offline therapy, it was like it happened over the first 2 sessions, but now it probably takes 3 or 4 sessions or even more. And especially like when we talk about mental health, and a lot of clients, they come from a place of a lot of trauma. Like it could be extreme big traumas, they could be smaller traumas as well. And it is a lot of, like our priority there is bringing in a lot of safety for the client, and maybe the environment that they are currently present in might not be very safe for them, maybe their home or wherever they are taking therapy from. And similarly, maybe they are in home and they don't have a private space where they can approach therapy. So there is definitely like a lot of limitations which are associated to it. But then I also feel like, it is open to stay open to the possibility of online therapy, because we are sort of being able to be more accessible to individuals. So maybe certain areas, where mental health professionals aren't available, and if we look at the ratio of individuals who are in mental health distress and the number of mental health professionals which are available in our country, there is a major gap between that. And there are so many cities, so many, prominent areas where there are no mental health services available, no mental health organizations operating. So this online services, telemental health services, they are sort of bridging the gap between that. It is making mental health more accessible in those terms. And I also feel like, like somebody like the country's government talking about mental health, it really normalizes the idea of mental health difficulties, which is very, very important. As Darren also mentioned, that there is a lot of stigma attached to it. And one very key feature that really struck out to me was that they are going to be, they're going to launch a TV program around mental health, which is, I feel like, which is such a beautiful initiative, because television, it is, often something that the families watch together, and people of all age groups, they watch television. And having a TV program which talks about mental health, that will really help in normalizing the entire idea of mental health, and maybe initiate conversations within the families which might not be happening right now.
Right, rightly said. But as they have mentioned, like there are going to be 23 centers all over the India. So when can we accept it's going to start? When it's going to begin? Like the National Telemental Health Program, when it's going to begin, and how much do you think it's going to take to aware all the people to take up? Because if we see majority, like 60 to 70% of people are suffering for mental health, but they don't know about it.
Yeah.
So any of the panelists would like to take up this question?
I can respond to that briefly. I think that's a very important question. I cannot say for sure when it will launch, because it really depends upon how long it takes to set that infrastructure and train the staff. So there's a lot of capacity building that's required, not just within the community, but it's also required within the mental health professionals, as Ms. Ananta had mentioned. It's very important to understand what the scope of these services are, and it's really important for us to adapt and exploit those circumstances to the maximum. With regards to the services, I think it's equally important to provide services and to create awareness, because without creating awareness, there's not going to be utilization. And that's the problem that we have with most of our public health services. Without good awareness, without good mental health awareness, or without good health awareness, there's not going to be utilization of services, no matter how convenient or how accessible we make it. And for this, I think it's very important to reach out to multiple stakeholders. So the mental health of a child does not, it rests on many people. There are many people that are involved in that care that's been provided to that child. So that there's a child that needs the care, there's a parent that needs to be educated, and awareness needs to be built in parents. Along with that, we also have to build awareness amongst teachers in schools, because they need to recognize mental health distress or disorders early, and they need to be in a position to inform parents on utilization of the service. And there's also a need for building awareness within not just the mental health professionals, but there are other primary caregivers like grassroots healthcare workers, ANMs, ASHA workers, Anganwadi workers, and primary care physicians that are not exactly in the line of mental health, not in pure mental health like psychologists or psychiatrists, but these other healthcare professionals also need to be made aware about health conditions, about mental health distress among children. So, as you rightly pointed out, I think the rollout of the program would have to be coupled with good awareness amongst the general public, amongst parents, teachers, as well as other allied health professionals that will be part of the caregiving process.
Definitely, sir. So we'll come back to the school and teachers, because our audience is majorly schools, teachers, parents, and students. Before that, Miss Tanya, I have my next question. You can take up my next question. Is like, as Miss Anantita said, it's going to take few sessions. So likewise, we are going to disclose our personality. We are going to share our personal details and so many things. So is there any law related to this? Is there any law if something happens? So law related to telemental health consultation.
Definitely. Thank you for the question, Shivani. It's a very relevant question because, my information or any information for that matter is something that is a buzzword. And it is so important because the whole concept of information is not restricted. It can be anything. It can be, it ranges from your name and personal details to, in this instance, mental health conditions as well. So, the ambit of what might constitute this information is vast. And when it comes to children, students, it's even more important to pay attention to these tiny details because they do not have the capability to understand what sort of information or what sort of data they're sharing with you. It might be with the teachers, with their parents, or even counselors for that matter, who will be involved in this whole process. So when we come to the point of if there is any regulation which covers the concept of the personal information, yes, I would say definitely there is. So currently we have the Information Technology Act, which takes care or caters to basic data requirements. So it requires all companies, corporates, or any individual body which comes in contact with any such personal data to maintain certain compliances. Now this is obviously meant to protect data, and because data is everywhere, like right now we are speaking and this is all data for the future. So in addition to this, when we talk about health data, we have had there are specific rules which can be referred to as reasonable security practice and procedure rules. In short, I would refer to them as SPDI rules. So for all the viewers, it's easy to go and look up for these rules and refer to them in the future. So these rules specifically categorize all health related data, that is mental health related data or physical, physiological related data, into sensitive data. So when you're dealing with these, when the school individuals, administrators, counselors, or any individual, if they are dealing with this data, they need to ensure that certain requirements are met. Now, this would be more technical in terms of the people who are actually collecting or processing this data. But when you look at it in simple terms, it would require you to maintain confidentiality, take consent from the parents. When you're talking about student data, take consent from parents, record these consents, and only retain data which is necessary. And all of this will have to be brought in within a proper framework when you're actually putting it into the administrative abilities. So yes, in these two terms, we do have the IT Act and the SPDI rules, which govern health data. And we do have a proposed bill on data protection. So that specifically also brings in within its ambit children data. So it hasn't been notified yet, but it's still in the bill process. It's still being discussed and it might come out as an act very soon. But that would specifically regulate children related content. And I think that would give us more clarity when we talk about, telemental health in schools. You will have to eventually look at these rules and check on, okay, what are the requirements, what am I supposed to do? Am I supposed to verify the age of the students, take consent from parents? And all of that will definitely be clarified soon. So I think these three are a set of rules or guidelines that you can look forward to in terms of student data while providing services.
Thank you, ma'am. I would like to ask next question to either Darren sir or Anandita ma'am. In a country like India, how can mental health consultations be done? Because it's like India is a developing country, so are there any guidelines, set rules or protocols which have to be followed and for those consultations?
So one thing I want to ask, when you ask about it in the context of India, like what are you exactly talking about? Like, are you talking about certain limitations which might be there in terms of accessibility or something else?
Ma'am, basically I'm talking about accessibility, yes, because that's the main purpose, to improve the accessibility. So, everyone has access to it.
Okay, and can you just like repeat the question once?
Yes, ma'am. What I mean to ask is that in a country like India, how can we, initiate or improve and increase telemental health consultations? Or are there any guidelines which have to be followed prior to it or for the same?
Okay, so when there was a shift, to like from a normal life to the pandemic life and all of these, and there was this raising awareness about the rising mental health concerns, and all the therapists, they switched to online therapy. So a new set of guidelines. So we always have certain ethical guidelines when we talk about the therapeutic process, when we talk about counseling, but there was an extra set of guidelines that were released for teletherapy in the beginning only. This was released by NIMHANS. And again, so as I mentioned earlier, there are, extra limitations, there are more guidelines, there are more, things that we need to be a little more careful about in terms of therapy right now. And definitely, like even in the Indian context, like because there is a lack of awareness, because a lot of individuals, when they are taking therapy, their families do not know about it. And there are certain times, when the situation might be very severe, and when we do offline therapy, we make sure that we take certain details of some caregiver, some primary caregiver, maybe their parents or somebody else that the individual is comfortable with, because if something happens, we can inform them of if there is an area of concern, if the client is suicidal, for example, or if they are been having these thoughts. It becomes the therapist's responsibility to inform that person, the parent or somebody who is present in the client's immediate environment. Now when we talk about teletherapy, the individual can firstly directly refuse to give a contact of someone else, an emergency contact, or maybe because it is online services, the amount of information that we have access to as therapists, that is also very limited. So in these guidelines, the new guidelines that we got for teletherapy, one, we always take informed consent. So that taking that informed consent has become more prominent right now, having documentation that the client has signed up for taking these therapeutic services. And in that informed consent, earlier it was probably just about letting the client know, like the client signing that they're coming in here voluntarily. Now we write down, it's like a 3 to 4 page document where we mention everything that has to do with therapy. So we mention all the aspects of confidentiality, all the aspects of privacy, as well as an additional guideline that if something happens, because the therapist is in a very limited position and they might be, like in a different geographical location, if something dangerous happens, it is the client's risk. Or if the client is, like in a dangerous situation, or if they might cause harm to themselves, the client is signing in that form that they will definitely inform either the therapist or someone else in their immediate environment. So that is one of the things, that responsibility has now shifted from the therapist to the client, because the therapist has those limitations in nature. So it's certainly like a lot of additional guidelines that have come into the picture. And talking about the accessibility issues, again, I think that is something that we have observed in all areas, even in the educational setup. Like a lot of kids did not have access to education. There was a brief time when I was working with communities in Himachal Pradesh, and I noticed like it was direct community engagement, and there were houses with 4 to 5 members and just one smartphone, and a lot of times they didn't have access to a network, and we did a lot of data collection also around the number of smartphones, and there were so many, and because they are community areas, there are a lot of children in the same family. They are not small families, they're huge families, so a lot of children who are going to school but they only have one smartphone in the entire house, so not everyone can like attend their classes. So definitely we do have a lot of accessibility issues, we do have a lot of limitations, but I think then there are also a lot of initiatives now being taken because of the pandemic situation, because these technological devices has become so crucial for our sort of survival in a way, to function optimally in all our different domains. So a lot of initiatives that are being now taken to increase these technological accessibilities, and then again, if we are normalizing mental health in these ways, that will also help individuals prioritize their mental health, prioritize taking mental health services, even if it might not be accessible, there might be extra initiatives being taken by the stakeholders, by the government, so that they can sort of ensure. I think it will be a very long process. I think I'm talking about a very far off future, but maybe just I think initiating this conversation is a very big step up, and probably will only go up from here.
And maybe if I could add to what Ananta was talking about, I think one of the first hurdles that we have to deal with is how do we standardize mental health delivery over a digital health platform. And the reason that becomes important is because we are dealing with a fragmented healthcare system, right? So we have different systems of medicine. So even within mental health, you have psychiatrists, psychologists, clinical psychologists, and counselors. And all of them are regulated by different people. You have the National Medical Commission, you have the Rehabilitation Council of India, now you have the new NCAHP for allied healthcare professionals. So how do you pass or put out a guideline that could be applicable to all the different kinds of practitioners in this space, so that you make sure that there is a particular minimum standard and a minimum guideline that you follow when having a consultation with the patient, right? Be it a minor or otherwise. So I think there is a lot of work that's been cut out for NIMHANS in terms of how we can figure out that standardization. And really, I think the only way we can do that is by having everybody come to the table, so that something uniform can be passed, regardless of whether you are regulated by A or B, right? So that's something we can do together. At least put down the minimum requirements in terms of how to deal with emergencies, how exactly consent can be taken, what kind of confidentiality provisions that we need to apply. If these kind of things are ironed out, and then after that, getting into the nuances of, if you're a psychiatrist, what kind of medications can you prescribe over telemedicine? If you're a counselor, what kind of requirements we need to take care of as well. These are things that could be taken up at the nuance level, but we need to have a uniform basic standard for all counseling on this platform.
Right, definitely so. And coming back to the students, now, as I said, we have most of the students and parents here. So Dr. Josh, my next question is to you, like how we are going to make children feel comfortable virtually. Like first, they are so fed up with the online classes. And second, we as an adult don't understand what's going on inside our head, or we don't understand our emotion. How we can expect students to understand all these things?
Right. I think the question probably would be better answered by Ms. Ananta, who's a clinical psychologist, and she specializes in child psychology. But I think there are, so it's important to understand that when we talk about mental health, it's a spectrum. It's not just normal and abnormal. There's mental health, there's mental well-being. It's not just about treatment of mental disorders, but it's also promoting mental health well-being, and it's also about preventing mental disorders. And there are various tools, and I'm sure Anandita could probably elaborate on some of them. There are tools for screening, for detection, and it does not necessarily have to be the entire treatment that's given through a telemedicine portal. It could be either the follow-up care alone, it could be the initial evaluation or the screening alone that has to be done on a telemedicine portal. So the idea is not, I don't think a national telemental health program is going to cure the entire nation of its mental health problems, right? It's just a step. It's a very critical step. It could be used to improve screening detection. There are many tools, there are questionnaires that are there that are available that can easily screen children for depressive episodes or stress or anxiety. So these are simple things that can be administered through a telemedicine platform. Now, it could be used for follow-up care. So in that case, the child already has a rapport with their psychologist or with their psychiatrist, and it's only about following them up through sessions. And this also helps reduce a lot of the burden that parents may face in actually going to a hospital or a mental health care center, regularly for their sessions. So it could be follow-up care, and in that case, again, the rapport has already been built. Now, regarding how we can make children feel more comfortable, I think that completely depends upon the mental health professionals, because they're trained in these things. They're trained to build rapport. They're trained to build rapport, whether it's virtual or in person. They do have their techniques to make the child or the adult feel more comfortable sharing their information. And I think that purely, I think more than the child feeling comfortable, I think it's the mental health professional that needs to be trained or build capacity for in building that rapport with their patients on an online platform. But I think most mental health professionals, be it psychologists or psychiatrists, in the last 2 years have engaged in telemedicine. I can add to that previous question that was asked about guidelines. There is a general overarching guideline that was released in March 2020. It's called the Telemedicine Practice Guidelines, or TPG. It was released by the Medical Council of India. It covers most of the aspects of healthcare over telemedicine platforms, and it covers a bit of psychiatry also. It's also listed on what drugs can be prescribed and what drugs cannot be prescribed. So there is a set of guidelines already present. So I think to answer your question in brief, I think.
I'm so sorry, sir. You went on mute.
Sorry. So to put my answer in brief, I would say when we look at telemental health, I would suggest firstly we need to stop thinking of as the entire comprehensive care being delivered over a virtual platform. And secondly, I think with regards to rapport building over a virtual platform, I think it completely depends upon the mental health professional or the caregiver than the student, because they are trained to build that sort of rapport with their patients.
All right. Ms. Anandita, would you like to add on this?
Yeah, I would like to mention that, it is definitely like a lot more additional effort on part of the therapist, because also a lot of our training has happened offline, like a lot of existing mental health professionals. We have been trained in offline setups. We never even imagined online therapy, especially with children, because children are, like it's a lot more difficult to gain children's trust. And most of the time, especially for younger children, they come in because someone else has brought them in. They aren't really coming from with their own will, and it's really difficult to get through children in these terms, no matter what the difficulty is, no matter how the child is, because to them you're a stranger. You are somebody they aren't at all familiar with, and no child engages with strangers, right? On a very comfortable level. And earlier there were a lot of things that we could do, like just to build rapport, maybe playing with the child, certain, like especially in child psychology setups, there are always certain toys, certain board games, certain colors, crayons, paintings that you can, a lot of the first few sessions are just in it is about engaging the child in certain fun activities rather than actually talking about the mental health aspects of the child. So it is very difficult to get through that in an online setup, and I think, I don't know, I haven't worked with young children in an online setup yet, and I really don't know how that is something that could pan out right now. I can't really imagine, because talking is something, like it's easy to say that you have to build rapport, but with a child, I feel I can't really imagine how that would be like, especially even for the parents who would be bringing in that child, letting the child like making sure the child is sitting in front of a screen, in front of a stranger on the screen, and actually talking about things or listening to what might be being told to them. So I think an alternative maybe could be certain group sessions, certain group calls, where maybe this is something that can be said in context of schools, maybe where their classmates are present, where they can be a little more interactive rather than like an individual to individual session. But yeah, I think it is like, especially for children in terms of mental health, I think it is like a very difficult shift from offline to online.
Ma'am, like you rightly mentioned about, children and, parents also. Since, at home, parents are their mentors. So do you think that parents and teachers equally have to be and should be involved with their kids and students in the sessions which are given to them?
Undoubtedly, definitely. Like, I think before talking to the children, it is very, very important to engage with parents and teachers, because they are the adults,
Yeah.
they are the ones responsible, and they are also the agents who are actively involved in, the formative years of the child, the development of the child. It could be either it is about the physical growth, physical survival, or about the psychological growth. And most of the theories of psychology talk about the primary role that the caregivers have in the psychological development of the child, and how the experiences in those early years have lifelong experiences on us, how our attachment styles are governed by the kind of relationships we shared with our parents. So it's extremely important. I think it is primary to involve the parents, to involve the teachers, to speak to them about mental health, to speak to them about parenting styles, and what are the right ways of parenting, because I'm sure all parents have the right intention. They're all, they want the best for their child, but they might not genuinely know what the right approach could be, or they might feel like they are doing the right thing, but their approach might be something which is not very helpful for the child. And similarly for teachers, because especially teachers are somebody who are engaged with the child for half of the child's day, and maybe the child is interacting more with the teachers as compared to the parents, because nowadays we have working parents, and like the teacher or the babysitter or the tutor and teachers are someone who are engaged in a social setting, like a lot of social skill development as well. A lot of socializing is being done by the teacher after a certain age. I think teachers play a more important role as compared to the parents. So it's very, very important to involve the teachers as well. The teachers might be spending a lot more time with the child. So if the teacher knows how to identify, even identification is a very important aspect here. Like, intervention comes in much later, and intervention is something that we can leave to the mental health professionals. But the teachers and parents, they need to identify, they need to recognize certain signs and symptoms which might be present in the child, which might be being overlooked if they don't know about that. So yeah, I think it is very primary, especially when we talk about children and we talk about our young population. It is very, very important to involve the parents, to involve the teachers, and even for like older adolescents, if we talk about them, it is very essential that they have the sort of parental support that they require to work on their mental health. Even if they might have resources available, they also need that family support. They can speak to their parents if something is going with them. They don't have to hide and speak to the school counselor, or they don't have to tell their mental health professional that please don't tell my parents about this. So like, they also need to have that safe space. Maybe the school counselor is working on them, but when they go back home, it comes back to square one, because they don't have that environment and they don't have that support. So again, another very important factor as to why we really need to involve the parents and teachers into all of this.
Definitely, ma'am. We, being a school health organization, we also feel the same thing. And I think before children, it's important that we focus on our parents and teachers.
Yes, for sure.
Right. My next question is to Ms. Tanya or Mr. Darren. Like, what are some of the major barriers that we are facing right now in our medical health services in India? Some of the major barriers you think?
I think I'll begin and then Darren definitely can add on. So I think when you talk about barriers, there might be ample because any process that begins, you eventually figure out that, okay, this is a challenge and you might not be able to, configure everything at once. So when we come to legal or rather some of the administrative barriers that I personally can identify when I'm looking at this whole platform that, we are seeking to bring in, one would definitely be in terms of I'm sorry. Yeah, 1 second. Sorry. Yeah. So one would definitely be, like I talked about, the privacy issues that will come up, and you need to ensure privacy of these individuals, of the students, and anything that is shared between the students. Second, privacy consent. Obviously, Anandita had pointed out that there was a responsibility on therapists and counselors on ensuring that you take consent, you make them write those forms and you tell them, okay, this will be confidential, but that shift in responsibility between the counselor to the parent might be something that we will have to look at. And when we're looking at telemedicine or a functioning of this whole platform, we do have telemedicine practice guidelines, which was pointed out earlier in this webinar too. But what needs to be looked at is that these guidelines specifically are only applicable to registered medical practitioners. So it's not that all counselors, all psychiatrists, psychologists fall within this ambit of registered medical practitioners, but it does exclude a lot of other healthcare professionals. You would be shocked to know that even dentists aren't really brought within the ambit of the telemedicine practice guidelines. So we cannot even fathom as to what category of individuals are not covered, and their practice, their consultations are not really guided by these guidelines. So we will definitely need to look at a wholesome guideline that, like Darren had pointed out earlier, would encompass this whole telehealth service that we're looking at. So I think that would be a major barrier, because when you don't have guidelines, you really don't know where to restrict practice, what to look at when you're looking at, okay, this is allowed, this is what I can do. And as counselors, we would know how to practice, but as individuals who are not aware of this whole practice, I would not have any direction to look at. So yeah, I think a wholesome guideline which would guide the whole telehealth service would be something that we should look at. And right now is a major challenge. And I think, Darren, if you wish to add something.
So I think the only thing I'd like to add is that there are some inherent limitations to telemedicine, which I think, so basically there's an expectation management that needs to be set to the extent that, I think the patients need to be sensitized that telemedicine is not an absolute replacement for physical, healthcare services. So I think trying to scope out what can and cannot be done within the digital health setup needs to be identified. And the guidelines issued by the NMC is good to that extent, because they do provide some of these limitations, but we may need to extend that to cover the other professionals in the space as well. But I think the primary responsibility for helping the patient understand in what scenarios you can approach for an online consultation versus when you can go to a physical consultation is on the professional themselves, right, or the platform. And I think that also talks about, I think one question that had come in from Anupam, where basically, the professional needs to determine using their professional abilities as to whether a patient requires physical care versus online care, especially in emergency situations. I think the task would be then for the professional to guide the patient to the nearest healthcare facility, so on and so forth, right? So I think the driving point that needs to be sensitized to the public is that this can be a bridge to physical healthcare, but it can never be a replacement. And as long as people understand that inherent limitation, I think that would also be helpful in the long run.
Right, definitely. So
Can I add something?
yeah, definitely, ma'am. Please go
Yeah,
ahead.
I feel like when we talk about barriers, especially in terms of telemental health services, I feel like these services are sort of a privilege, which are only, accessible to a few. If we come back to the accessibility issue, so, like how we talk about education, and even in the online mode, the education was reaching out to everybody in the country, but is every child being able to access that education? So similarly, I think we need to, sort of look at this also in a critical lens, where the telemental health services, they might be present for everyone, but is everyone in the country, in different areas of the country, are they being able to actually access these services, and how are we trying to bridge that gap?
Right, ma'am.
And I can briefly add to what Ms. Ananta said, and I think that's a very important point. And this is something that I hold very close to my heart, which is digital health equity. I think digital health equity is a very, very important topic that needs to be discussed more, especially considering that a lot of digital healthcare is replacing conventional care. Ideally, as Darren pointed out, it should not be a complete replacement, but these things do happen at times, right? So it's like how physical cash has almost been completely replaced by cards or by UPI payments, right? And no one expected it to be like that, but it does cause inequity. It does cause discrimination. It does cause, the digital divide to increase, and that's a risk that all of these digital health programs have. And it's very important to look at that from the start. It's always very important whenever we are instituting a large digital health program or a telemental health program. It's important to look at it from the digital equity lens and see that there is no social ecological discrimination that happens while we give these services. And I think that's really important. And for that, we need to work on digital literacy. We need to look at the technology level barriers at the level of parents, at the level of the teachers. It's very important to find ways around these things to improve the literacy levels of the parents for technology, not just just literacy alone, but literacy is also very important. Apart from that, the technology level barriers. India is a very diverse country. There are language level barriers. Most of the telemedicine platforms have English-based systems, and that itself is a form of digital health inequity. So there are a lot of aspects that need to be looked into in terms of digital health equity. And I think that's an area that's very neglected in India. It's not really governed by laws well enough. And if we do not take care of this issue from the start, it's going to lead to a digital divide, or the digital divide increasing over time.
Right, sir. Thank you so much to all the panelists. We are having, such an insightful conversation. But we have some live question as well. So I would like to request Preeti Sekaran. I'm sorry if I mispronounce your name. Preeti?
Yeah, that's fine.
So can you please introduce yourself? Where are you from? And then you can go ahead with your question.
Yeah, sure. I'm Preeti. I'm Dr. Preeti. I'm from Hyderabad. I'm currently doing my master's in public health. So my question was, I think it mostly got answered in the past few minutes. It was about the digital divide that Dr. Arun sir was talking about. So yeah, I want to know how that would really hamper the provision of the services that we plan to provide, the telemental health services. So yeah, that was my question.
So I know I've answered that very briefly, Preeti, but thank you for that question. And I think this is a topic that needs to be discussed more often. But there are various frameworks and there are various tools that are available that can help build a digitally equitable system of healthcare. There are tools that look at the socioeconomic status, the literacy levels of the people that are using these platforms, the technology level barriers that are seen by parents or by teachers or by the patients in the use of these platforms. So there are various tools that are available that can help prevent these digital health inequities from creeping into the system. And I think it is possible to build a system that actually helps everyone.
Sure. Thank you so much.
I think the government holds a lot of responsibility here in making sure that they are not done with the job if the telemental health services are available everywhere. It is also very important to identify which are the groups who actually have access to those, who are actually being able to utilize those, and which are the groups which are, sort of being neglected here and they are not able to access these services at all.
And if I could speak for India's progress overall, I think we've come a very long way in terms of getting digital literacy in the country, especially when you compare that with other jurisdictions. We skipped the whole PC era and moved straight to mobile. And I think the overall penetration of mobile internet and smartphone access has reached a phenomenal level, especially because of various providers who are able to provide affordable devices in the market. So because of that, I think we're seeing a lot of adoption right down to the rural areas, which is a great. I would say it's something that we don't see so much in some other countries, and I think that's a big plus point to try and bridge that digital inequality in India.
Thank you. We have another question from Cine. KO, I am sorry if I mispronounced it, but are you there?
Yes, I am here.
Yeah, can you just introduce yourself and then ask your question?
Yes, I am Sidney. I am from Kerala, and I am a teacher. And I feel that because of the online platform, okay, it is really help the people on the other side. But when we see to the other side, see the mental health of the students, they are becoming more dull and diverted minded, and they're more addicted to social medias. Okay, we know it is for the good, but you see, many of the times the students are more addicted to social media. Do you have a comment on it?
Any of the panelists can take up this question. It's directly from our teachers.
I mean, I think Ms. Anandita would be good to answer that because of her background in clinical psychology. But I think I would say the children being dull and engaging excessively in the internet on social media platforms is not necessarily. I think it's difficult for adults to understand what they're going through, but it's a reflection or it's a projection of a mental health distress that they are going through. And it's important to identify what is the mental health condition that they are facing. I mean, it's easy to see symptoms. Like for COVID, we have symptoms like cough or cold, or we have a sore throat, and it's easy to understand what the symptoms are. But in a mental health illness, these are subtle indications that the child might be going through a depressive episode, or the child might be going through a learning difficulty, right? And these are important to identify, and especially in the online digital world that they are in right now, and with the amount of teaching that goes in, there are long hours that they need to spend in front of a screen. I personally am working from home since the past 2 years, and it's incredibly difficult even for adults to sit in front of a screen for this long. So it is taking a toll on the children, and these behaviors that they are showing, that is excessive use of social media or excessive use of the internet, are basically reflections of their internal mental health issues or their mental health turmoil that they're going through. And I'll ask the other panelists to add on, just from my very, very limited understanding.
I feel like if you look at the situation, can you really blame them? Like, we have literally put on those devices in their hands. And I feel like given all the external factors, all these things that we are seeing, it is the most normal reaction that they could possibly have, being addicted to their phones, because that is the only world that they have right now. Like, it might be changing a little bit now, but especially in 2020, when we had this strict lockdown and you can't step out of their house for, like, you couldn't step out of your house for months and there was nobody that they could interact with, then where do they turn to, right? They turn to social media where there are other individuals of their age groups. They turn to these platforms where there is some content, some information which they can consume, which is relevant to them, and which is not really present in their environment. So I personally feel it is the most normal reaction to have. Of course, it is having a lot of severe consequences on their mental health, especially with the younger children who might not have ever interacted with people of their age group, other kids of their age group. They've never seen what a school looks like. All they know is like a Zoom screen in which another person is speaking. They don't even know the meaning of a teacher or friends or groups. So I think, of course, it is going to have a lot of long-term consequences, and I really don't know. It looks very scary in that terms, because their social skills, their social interactions, which were very crucial for their overall development, they are being really hampered. And but I really don't think we can ever blame the children about this, because, like, where else do they go and what else do they do given the entire situation, right?
Thank you, ma'am. Uh, Another question that I would like to ask is that what do you think? What kind of remedial measures can be taken in the event of an issue, arise during teleconsultations? Because many arise. So what can be done that time? Means any of the panelists, if they would like to.
Sure. Yeah, I'll take that up. So I think, we do have a robust framework to take care of issues that can arise, both from, the perspective of professional regulation as well as consumer protection. So, on both ends, we do have certain checks and balances to make sure that the standard for healthcare does not fall merely because it's being provided on an online platform. In fact, most of what is applicable for in-person consultations will continue to hold good even when we're coming with digital health services. And to that extent, if we even look at the guidelines that have been released, all of the kind of confidentiality, privacy, all the different kinds of requirements on the professional hold good, even if it's being done on an online platform. And that being said, if tomorrow there is an issue arising from any consultation that's taking place, there are remedies available in terms of the consumer being able to seek redressal before a consumer commission, or they're able to complain to a regulator who is able to take professional action against the professional who may have erred, right? And of course, see, one thing that we see very closely, and I think beneficially for the healthcare profession, is that courts don't always look at technical matters. They leave it to the experts to deal with them. So in a situation where there's a question of misconduct, or where there's a question of professional negligence, these are questions that need to be answered by the expert regulators themselves, and they can take a call as to whether that professional should continue in the profession, should there be a suspension, should there be a cancellation, etc. And I think because of that, there is a healthy check and balance to make sure that in the event of such a issue, we do have possibilities for redressal as well.
Yes, sir. I'm so sorry. So my next question is like, just give me a second. Yeah. How we are going, I mean, how a layman is going to avail these services, how it's going to be possible. So, which is a very basic question we are getting from the audience, like how they can avail these services later. Ms. Tanya or anyone? Yeah, Arun, so.
Tanya can go ahead.
Yeah.
I think if we're talking about present, then we've already had a discussion on how we think of, starting it at the school level and taking it forward. But when we talk about availing these services outside the school setup, I mean, it's more on what framework you actually put in. So when you are offering these services, when the students are in school, yes, you might have a bandwidth of, say from first standard to 12th standard, and okay, you have access to students, their data, and the counselors are the same. So you have a continuous flow of information and these, counseling sessions. But I think beyond that, there you may the administration that is looking to put forward this whole concept of telehealth, they can think of retaining certain data. Obviously this would all be by the consent of the parents, because yes, you are seeking the consent of parents till the child turns 18. What after they turn major? Like what after they decide to take their mental health decisions on their own? Because that is also something that we would encourage, if I'm not wrong, Ms. Anandita, like you do encourage them to take their own decisions, right? So after that point, maybe something that can be looked at is the retention of these health records that might have been collected during their school phases, and then directing them to maybe other counselors, maybe other platforms, telehealth services, which can take it forward, which can take this telehealth service forward. And in all of this, I think there needs to be some coordination between the counselors, the school professionals, the teachers, parents, because there will be a lot of the data that will be retained and a lot of data that will be passed on. So this would more or less be in terms of retaining such data and passing on such data to ensure like a continuity of these services even beyond the school premises, beyond the school environment. So I think that would be something that we can look at in the future for continuous.
I think we add to what Tanya said. With the Ayushman Bharat digital mission being launched, I think there are some services, telehealth services already in place. The eSanjeevani clinic and the eSanjeevani OPD and all of these things are already functional. And I'm sure that the government's intention would be to integrate. It wouldn't be to create different verticals, but this National Telemental Health Program would be integrated within the Ayushman Bharat Digital Health Mission. And apart from that, they are thinking of national health IDs and other mechanisms to ensure that there's continuity of care between different levels of the healthcare system. So as Tanya said, there are multiple stakeholders involved in the care that is being provided through the Telemental Health Program. But I'm sure there would be a mechanism put in place by the government so as to ensure that all these systems talk to each other and that the patient data is secure, as well as being shared between different physicians, and it becomes a part of each person's national health ID. And I think the Telemental Health Program per se, at least the clinical services would be provided in a very similar platform as the eSanjeevani platform.
Thank you, sir. I would like to ask you another question. Any of you can answer that. What do people actually more prefer? Which medium is more suited? Means offline or online by even therapists and even clients?
So in terms of therapy, a lot of clients do prefer offline therapy in terms of the comfort that they feel and the sort of safe space that they have for that brief moment of therapy. But then also, like online therapy, it is saving us a lot of time if we look at it, especially given the hustle culture that we are in right now. It just, it reduces the time of traveling, it reduces the time of waiting for your session. So, you can just like be wherever, be doing whatever, and just click on a link and enter your therapy session. So in those terms, it is more convenient. But in terms of the therapeutic process, in terms of the the mental health benefits, like definitely like offline therapy has a lot more benefits. It is a much better space which is created for the clients. But yeah, like online therapy is slightly more convenient and slightly more accessible in those terms.
Yeah, I'd like to agree with Anandita. And in addition to that, with the COVID pandemic, it also reduces transmission a lot. You're reducing the burden at Shrikare hospitals, large hospitals. You're reducing the number of patients getting over there. You're also reducing interactions that can, increase the transmission of the COVID virus between physicians and the patients. So it's actually protecting both the patients and the physician. Now, I think the concept of which is better or which is most preferred, it's a concept that will change over time. It's a whole thought process thing, and it takes time for the way people view or utilize these services. It changes over time. So, for example, I'm sure and I'm going to go back to the cash example when the cards and UPI payments started becoming popular. I'm sure all of you on the screen also would have first preferred using cash, but then now I'm sure if all the people in the panel and including the people in the audience, if we all put our cash together, there'll probably be a few thousands in their wallets, because no one withdraws cash anymore. Everyone just uses their cards or UPI payments. And that's how the thought process changes, and people start to understand the convenience and the benefits of utilizing these online systems. But moreover, from a state standpoint or a systemic standpoint, I think it's very important for the public health system to encourage people to utilize these, because one is it has a lot of public health benefits. We stated a few of them. It improves access, it improves decreases the barriers related to distance and time and loss of daily wages, indirect costs due to travel and things like that. But in addition to that, it also helps utilize our manpower more, more efficiently. We have very few psychiatrists and psychologists. I think the latest numbers are approximately just 2 or 3 psychologists or psychiatrists per lakh population. And even those, it's very skewed. Their distribution is mostly in urban areas. So it's more of, I think the advantage is to the patients, but more of an advantage to the state, to the country, or the public health system. And I think it's important for the public health system to encourage the utilization of these systems and explain to the patients how it benefits them as well as society.
Rightly said, sir. But I think in many parts of India, there's still a lack of network connection and technology resources. But I think we'll cover up and we'll get back to it as well. So my next, there's one live question from Bindu Sharma. Can you please unmute yourself and you can ask your question? Hi, Bindu, can you hear me?
Yes, good evening, everyone.
Hi, can you please introduce yourself?
Yes, Bindu Sharma. Teacher, I would like to ask only one thing.
I'm so sorry for interrupting, but can you please be a little louder?
Yes, I'm audible to you.
Yes, now you are. Thank you so much.
Okay. I'm a teacher and I'm facing lots of questions from my student sides. Like nowadays, online classes are going on. So as per your this therapy, I just want to know the number of apps are available. Even Google, everybody is putting their trust on Google. Now YouTube's on trend. So it is very difficult to get the trust and making the faith in this teletherapy will work out very well for students, for parents, because everywhere data is going to misused. So my question is this: how it become trustworthy for student, parents, and teachers if they are going to share their problem, which they are not able to share parents, teachers, with friends? Thank you.
Yeah, maybe I'll take that. So I think data protection is one of the foundational requirements for any good teleconsultation platform. And at least when we look at all the established services that we have today, and we know this because we work very closely with a lot of platforms who offer telemedicine services and when they provide these services. So privacy is almost at the center of the entire ecosystem. And, I understand that there may be hesitation to think that, if I disclose something to a practitioner or a professional, will that then be leaked to other sources, etc. But I think we do have, at least most of the players in the market today are people who are following data protection requirements very well. And to that extent, I mean, not only because they want to, but also because they have to, right? I mean, when we deal with health data, we are dealing with sensitive information, and sensitive information is today heavily regulated to the extent that its protection and privacy are paramount. So I think sensitizing the people who are required to obtain these services to the extent that your data is going to be safe will go a long way in building that trust. And to that extent, I think a lot of platforms today are also highlighting what exactly they're doing to ensure data protection. They're talking about the security standards that they have put in place, and all of this. And especially if we're looking at a rollout of a national level program, if the government also is able to put out a policy that talks about how the data will be handled, how the data will be protected, that will go a long way in building that trust in terms of how your data is going to be used or utilized. Yeah.
I hope we answered your question, Ms. Bindu. Thank you so much, ma'am, for taking up this question. And thank you so much to our panelists. This was our last question. So anything from the panelists, like any closing statement for our audience? Like if you would like to comfortable them, if you would like to tell them about what mental health, if not mental health, but just mental health. So any closing statement from any of the panelists?
Yeah, so maybe I'll go first. I mean, I think one is I also learned a lot today, thanks to Anandita and Dr. Arun. Really, I think one key takeaway for myself is on the importance and impact of the digital inequality. And maybe we need to start thinking about what kind of public policy measures we can put in place to try and bridge that gap. And the other, I think, is the overall impact of digital health on the public health infrastructure. The way I would see it is that it's a triage, at least in a pandemic situation, where you're able to filter out people who are able to complete their healthcare services, at home, so that you don't add on to the burden of the existing healthcare framework, and still effectively provide that required healthcare treatment to a larger population at the same time. So I think we are moving in the right direction overall, and I think it's at an accelerated pace. Which I mean, if there's a silver lining to the whole pandemic today, it is that the adoption and use of digital health has become something that's been very well highlighted. So I think, I would like to see how well things move forward in the mental health space, especially how the government plans to adopt this entire scheme. But I think we're in good hands if we're dealing with NIMANS and the IITs of India having to be the ones who formulate the entire policy and process. So I think in the near future, we should be seeing a good and robust system for mental health as well.
Definitely. It's a long way, but I think we all get to it. So, Ms. Tanya?
Yeah, thank you. Yeah, definitely. It's just I think since our viewers are mostly school teachers and individuals associated with the school fraternity, I would like to say that the key takeaway from this session for all of us, including us as panelists, is that it's a move. The whole introduction of telehealth is a move to destigmatize the entire concept of mental health issues. And if as teachers you can adapt this from the grassroots levels, I think then that's the first challenge that we will take over. And from there on, we are already working on putting up these platforms, putting in all data requirements, privacy issues, and that's how we will also adapt. That's how counselors will also adapt, and that's where we want to lead to. Like, we as kids do not want to think of issues pertaining to mental health as oh, I cannot talk about it. But when we are allowing you or enabling you to even sit at home and talk about it to somebody else, having that comfort would begin from the teachers, from the school, where you make them comfortable about the whole concept in general, that this is normal. So from there on, I think that's where we can look about the future for this whole service. So yeah, thank you.
Thank you so much, Ms. Tanya.
Yeah,
Yes.
just adding on to that, as she mentioned, mental health is a very collaborative process in those terms where all these different individuals, different stakeholders, different parties really need to come together and work together, especially when we're talking about children or anybody in general. And also, the central government talking about this in the budget itself is a huge step up, because a lot of common people are involved when it comes to the budget, because there are a lot of laws, there are a lot of conversations that do happen about mental health sometimes, but they stay in the background. But it being talked about in the budget is a very major highlight. It is something that I'm not sure, but it must have been telecasted on all the news channels as a very prominent thing, as a very new thing that came up. So that in itself is a big step in normalizing it. And we as individuals need to ensure that that doesn't fizzle out, that doesn't fade away. And we, continue these conversations, and we continue normalizing the idea of mental health, the idea of mental health difficulties, different disorders and everything. And also making sure that we try to make these as accessible as possible. Just their availability is not enough. It is very important that we are able to bridge that gap and bring in individuals and connect them to these services more appropriately.
Right. I think that just leaves me, and I think my fellow panelists have covered everything. So I'm going to keep it very short. I think I learned a lot from this session, and it's very fascinating to see the interest that is there for the telemental health program. I think this is a very big and exciting step for everybody in India. That telemental health program is being launched and mental health is being normalized. At the same time, I would highly recommend people not to see this as a magic potion that's going to cure everyone of their mental health issues. It has its limitations, but if you can utilize the best aspects of it, I think it can make a big difference. And for it to make a big difference, as my other fellow panelists have mentioned before, it's a multi-stakeholder thing. There are a lot of people that need to play their part: policymakers, technology developers, the physicians, the therapists, the psychologists, the parents, the teachers, and the children. All of them have to play their part in accepting this and utilizing this. And only then can this be a success. And by being a success, again, I don't mean the mental health of the entire nation is cured through this, but it makes a big difference to the way people live their lives. It can lead to a lot more happiness and peace in the community, right? And I think that's the important thing, that all of us play our role in making this a success.
Yes, definitely, sir. Thank you so much. And thank you so mumuch to all the panelists. It was such an insightful session, such a wonderful session. We ourselves learned a lot. So definitely the question we were getting from the audience, we can understand, like, they were curious to know everything from all the panelists. So thank you so much once again. Thank you, Mr. Darren. Thank you, Ms. Tanya. Thank you, Ms. Anandita and Dr. Arun. Thank you so much. I think it was such a wonderful session talking about telemental health services, which is so relevant and need of an hour. So thank you so much once again.
Thank you.
Thank you. Thank you for
Thank
having
you.
us.
Thank
Have a
you.
good
Thank you so
evening.
much.
Have a nice weekend, everyone.
Thank you.
Thank you.
Thank you.
So, yeah, as I was saying, as I said earlier, we are going to have two sharpest question of the day winners. So the vouchers goes to Miss Preeti and Miss Cine. So someone from the communication team will get back to you, and congratulations, you get a gift voucher worth ₹500 for asking such a relevant questions. So thank you so much and congratulations to the winners. Lastly, we are going to have a small feedback form on your screen, and it's open for the panelists. So you can fill up the feedback. It just have 2 questions. So audience and panelists can fill up the question. Okay. And if any of your question is unanswered, you can post it by using #webinar by Sharp on our social media platform, and we'll try to get back to you with your answers as soon as possible. And your certificates, your e-certificate certificate will be mailed to you within 2 to 3 days. And if you find this webinar interesting, we conduct such webinars every Saturday at 4, and you can subscribe to www.schoolindia.org for latest update about webinars and all our programs. And now that we were talking about mental health, so Sharp NGO conduct free mental health awareness session for all the students pan-India. So any of the teachers, students, or principal would like to contact us, you can contact us or register your school using www.schoolindia.org. So thank you so much everyone for joining in today. And you can also support our work and know more about our Sharp NGO through different social media platforms. So, and thank you so much once again. Have a great evening ahead. Thank you.